प्रिय दर्शकों, श्रीमन अस्पताल की तरफ से मैं डॉक्टर वीपी शर्मा आपका हार्दिक स्वागत करता हूं। श्रीमन अस्पताल की तरफ से एक नया प्रयास शुरू कर रहे हैं जिसमें हमारे माहिर डॉक्टर आपको इन बीमारियों के बारे में जानकारी देंगे तथा यह भी बताएंगे कि समय पर रहते हुए आप इन बीमारियों से कैसे अपना बचाव कर सकते हैं और शुरू में ही इन बीमारियों को पहचान के अपना समय पे इलाज करा के एक लंबा निरोगी जीवन व्यतीत कर सकते हैं।
Hi viewers, I Dr.Ajay Marwaha, nephrologist from Shrimann Hospital. Today I will be discussing with you about kidney diseases. Everybody aware that the incidence of kidney diseases is increasing day by day, and you are daily listening, reading that the number of high profiles are also getting renal problems, and they have been scrubbed from renal diseases also. We have lost two main politicians because of the kidney diseases, and the incident is increasing day by day. We are seeing many patients, new patients, young patients entering into our OPD chambers daily without having a knowledge of kidney disease. They are not aware that they are having such a dreadful disease which is already punning up in their body. So, how to get aware? What are the causes? How to get an early detection of a kidney disease? This I will be sharing with you. Any query, any questions you want to ask, you can send us on our email, which will be printed on the base here, and we will be happier to get back to your queries. Now, I will coming first one by one. I will be discussing on the topic. First, one is what are the causes of kidney diseases? Why we are getting kidney disease? The most commonest cause of kidney disease is diabetes. You know, the world is now emerging as a very large amount of diabetic diseases. So diabetes is growing up, number of cases are going up daily in the world. Initially we were having some infectious diseases. Now the scenario has changed from infectious disease to non-infectious diseases like diabetes, hypertension. These all depend upon our sedentary life, our heating habits, and other environmental changing. So, since the diabetes is it is increasing in our life, so incidence of getting kidney diseases is getting more and more. So the diabetes are the one who get a kidney diseases later or sooner during the time. You can ask, does every diabetic causes get the kidney diseases? No, every diabetic does not cause the kidney diseases. If you go by the scenario, near about 30% of the diabetes they are getting kidney diseases. How other common causes? Again, the long-standing hypertension. It is another most commonest cause of getting kidney diseases. Now we have been getting a number of patients in which the kidney diseases is of unknown etiology, in which we are not able to detect the cause, but the culprit behind these are getting says that toxins are there in the environment or some chemicals are there which are affecting the kidney diseases, which causes the kidney disease in the body. Third is some genetic causes can be there, like we are getting inherited from our parents, that also causes the kidney diseases. And the most common is the over-the-counter tablets, painkillers, which we are taking without the help of or without the knowledge of the doctor, when goes to the chemist, get simple painkillers for any pain in the body. In long term taking up of painkillers are also causing the kidney disease. So diabetes, hypertension, unnecessary painkillers, unnecessary medications, these are one of the most common causes of kidney diseases. Now coming to what are the early signs of getting kidney diseases. So you can ask any diabetic how he can say that whether I am having a kidney disease or not. Diabetes, one of the most commonest in the diabetes is he will be start increase in frequency of micturition is there. He will start going to loo more frequently in the night, and secondly he will be producing more of the frothy urination. The urine will becomes more frothy, jag it will be there, so it will be more frothy in the urine. These are the one he can detect, or once he looks into the urine while passing it out, if he finds the more of the froth is there, he should be getting his urine done and consult the primary physician to which he is showing for the diabetes. And I suggest every diabetic should be evaluated, should get evaluated for the kidney diseases whenever he goes to his primary physicians. Long-standing blood pressures, again in that case also, if he is having a long-standing blood pressure, not controlled, not taking properly medicines, if he started having a swelling over the limbs, over the legs basically, he should start evaluating for his kidney diseases. So what? Swelling, one of the most commonest over the body, over the limbs. Secondly, increase urinary frequency, especially nocturia, that is when we pass more urine at the night, is mainly associated with underlying getting the kidney diseases. Third, a frothy. I will tell you what we mean by the frothy in coming my talk. Now coming to then decreased appetite, again associated with a kidney diseases. There is more of nausea and vomitings. They may be a part and parcel of underlying a kidney problem in the body. So the commonest is the swelling, increased frequency of micturition or urination, then frothy urination, then decreased appetite, and the dyspnea. When patient becomes dyspneic, it may be associated with a kidney diseases per se. How to detect at a personal level, like, and in spite of going how to get aware, even a person who is diabetic, he can go to a routine urinary checkup for a urine routine. I am telling you what is froth. Froth means you are passing more of the protein into the urine. So once the protein goes into the urine, it makes the urine frothy. So it becomes more of a soap-like urine. When urine passes, it is, when you flush it out, it seems to be have a soapy water or soapy look. So you get a routine urine test done, which if it is proteins are coming into the urine, it is one of the earliest sign of getting the kidney diseases. You have to be aware yourself. Your eyes or your mind should be immediately opened up that if I am passing or if I am getting albumin in the urine or the protein in the urine, I should be more cautious and should contact the nearest physician so that he can further refer to the nephrologist or the kidney specialist for getting further evaluated for these things. Other blood test investigations are now available. With the simple test, two tests, we can detect having kidney diseases. One is called a urea level, second is the serum creatinine. These are, again, you have to give your blood samples to the laboratory for detecting these blood urea and serum creatinine level, which can detect early involvement of kidney diseases. Even a small rise in serum creatinine, once is there, it is a significant. Some of time we may avoid these things. It is small thing is there, but even the serum creatinine, it increases a little bit more than the normal level, it is considered to be a harmful one, because at that time 50% of our kidney functions are already gone. So I've told you the what are the causes. Most commonest cause, I sum up, is the diabetes, hypertension, uncontrolled use of the painkillers, then the toxins are there, environmental factors, lot of chemicals are available which harms the body, and then comes the genetic causes which we get inherited from our parents. They can also cause the kidney diseases. Infections can cause the kidney diseases. I have told you the earliest signs and symptoms. Earliest sign is the one, earliest symptom is the one, you get the swelling of the body, and the signs is you have the edema. You can say that there is the skin in the legs get swollen up is there, and you can be easily check yourself by simply giving the urine and the blood test, simple two tests, in which you can be able to detect the kidneys are involved or not. Once the kidneys are involved, you have to, if this test becomes abnormal, you should check your own physician for getting further evaluated. Thank you. Thank you, viewers. Sooner we will be coming up for the prevention, how to prevent the kidney diseases, and how to get a treatment of kidney diseases. So the next, sooner we will be releasing you the message or the discussion on the prevention of kidney diseases. Thank you.